Hi, I'm Rebecca Frederick. I'm the Director of Engage BC with the BC Care Providers Association. I'm here today with SafeCare BC's CEO, Saleema Dhalla. Saleema, we've been hearing from our members that mental health is posing a challenge. How would you characterize the pandemic's impacts on mental health?
Significant. One word to sum it up. The pandemic has had a significant impact on the mental health of the people working in the sector. The 2021 member survey that we conducted earlier this year demonstrated that all work groups, senior leaders, managers, supervisors, frontline staff, they all reported mental health as a top safety concern. In some ways, this has brought forth an opportunity for us to create more resources to support mental health, because we know that all workplace injuries have a component of mental health that impacts those working in the sector.
It's the old adage of you can't pour from an empty cup, isn't it? It's so important that leaders take the time to really practice what they're preaching and address their own mental health. And it can really help to reduce the stigma, can't it?
Absolutely. And I think, opening up the conversation in the workplace, that it's okay to feel like this. And there are resources that will help you. They won't fix your problems, but they're there to support you. And you have colleagues and other staff in the building who feel the same way. And they might have some ideas for you to try out. And I think that's one of the great things about being able to bring people together in the sector, because they can relate to each other and they can exchange stories and they can exchange ideas about what works, so that people can try those things and see if it works for them.
With your conversations, talking to leaders across the sector, talking to staff across the sector, is there anybody who's not finding right now challenging?
I haven't talked to a single person who doesn't feel stressed, exhausted, anxious. I think every single person that I've connected with over the last couple of years, those are the things that they're saying. And it's no secret. And there's no shame behind it. This is hard. This is really hard. And every time we think there's light at the end of the tunnel, something else comes along. And that's not easy, especially when you're in a leadership role and you're expected in a lot of ways to have the answers, to have it together. I think it's challenging, and I don't think there's any shame in that. I really hope that the leaders in the sector feel like they have the support from their peers. And the ones that I have talked to that have participated in the leadership program that we've put out have said exactly that being able to connect with other people who are feeling the same things as them has made it so much easier to open the door and face the staff and be there for them like they want to be.
BC Care Providers Association and SafeCare BC are collaborating on a mental health webinar on January 27th. Can you tell us a little bit more about that?
Yeah, so what we've done is we've taken all of the lessons learned from the Leading from the Inside Out program and the 6 cohorts that have participated so far, and taken the main themes that leaders reported to have learned as they walked away from that program. And we've put them into a 75-minute webinar so that people can listen in and learn what some of the key strategies are that they can take away and implement right away to make a change in the way that they're taking care of themselves so that they can be stronger leaders.